I've seen a crike, I've seen a floating face fracture, I've seen rats. Is this the most accurate medical TV show ever? The PITT on Max takes place in an ER. I've worked in an ER for 10 years, so let's see.
Where are we going now?
We need the room for someone else, but you can rest in the hall until we get your labs back.
Yes, this will happen. If you are a patient in the ER and you are lucky enough to get a private area, this isn't even a private room, which is very common in the ER. A lot of the spaces in the ER, you're getting covered up by a curtain. That's your private area. If you're lucky enough to get a private area in the ER, there's a chance that we will move you from that private area to the hallway. Yes, we utilize all the space in the ER because we're constantly short-staffed and we don't have enough space to keep patients. This patient got a little unlucky, or lucky. He's healthy, which means that we feel like he can go into the hallway. Unlucky, he loses his little private area. That private area will now be used for patients who absolutely need any sort of private assessments. Very realistic.
Your dad has an advanced directive expressing his wishes, which says that IV fluids and medications are okay, but no artificial life support, no CPR.
An advanced directive basically gives the healthcare workers instructions on what you want to be done towards your end-of-life care. This patient in particular is okay with IV fluids and medications, but he does not want to be resuscitated if worse comes to worse. DNR, advanced directive. We like to see that in the ER, so we know what to do. Yeah.
But if he can get better in a week, then put him on a machine.
That's not what he wanted.
That's not what he...
Either of you have durable power of attorney for healthcare?
Yes. Okay, here we go. Classic complication in the ER. The patient has an advanced directive saying, do not resuscitate. Children come in, see their dad is not doing well, has the power of attorney, which it looks like they do, and they can change the advanced directive, which happens all the time, right? They come in, they see their family member as a patient, they see they're not doing well, they get really sad, they're like, okay, I changed my mind, I can't see this, I don't want them to go yet, I'm not ready. Do everything you can to save them. That complicates things for the healthcare workers because now we're like, what do we do?
If things get worse, sometimes allowing for a comfortable natural death can be the most humane path.
Yes, it can be the most humane path. We're not trying to be insensitive. Sometimes the best thing to do is just to let them go rather than doing CPR, sticking a tube down their throat, sticking tubes in other parts of their bodies to keep them alive, and destroying the patient's body when we know they don't have a good chance of survival anyways. Very realistic.
23-year-old Ben Kemper, no helmet, got doored riding an e-scooter. Neck versus handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals.
Okay, patient on e-scooters. These electric scooters are terrible. Never get on one. Never get on an electric scooter. They go so effing fast. 18 to 20 miles an hour, and it is so dangerous. You hit one little chip in the road, you're flying off that thing at 18 to 20 miles per hour. Most of the time, you're not wearing a helmet. Some of the worst injuries I've ever seen. I've worked in the ER in the Bay Area and LA. These electric scooters, I feel like, were born in the Bay Area and moved their way down to Los Angeles first. I have dealt with these e-scooters firsthand. They produce some of the most horrific injuries. I'm talking broken bones. I've seen moms get on these things and injure their heads. They're not waking up. I've seen people destroy their ankles on these things, trying to like jump off when they're getting a little too scared because it's going so fast. Never get on one of these e-scooters, please.
That's probably from the nosebleed. Short rapid rhino, please.
A rapid rhino. This is something we use in the emergency room for nosebleeds. It's basically a little balloon that we'll put in your nose and blow air into it using a syringe. The balloon will pop up and stop the bleeding from coming out your nose. Very common thing in the ER. Very realistic.
What's up?
Good vitals, A&O. Let's have a look.
Oh, fuck.
Floating face.
A 4-3 fracture.
You don't see that every day.
Oh,
Okay, let's
what
prep
the-
for airway, double setup just in case.
Okay, yeah. What is she? A floating face fracture? That's disgusting. Also crazy. I've never seen one in real life, so realistic? Maybe. A little bit of a drama for the show, of course. That's pretty crazy. I didn't know that's what that did, but it makes sense. If you work in the ER and you've ever seen a floating face fracture, comment below. How many have you seen?
Prepping the neck just in case.
Let's have a look. A little deeper.
Lots of swelling. I can't see the cords.
To the right. The left. Yeah, really distorted from the trauma, and the demon's only going to get worse.
Which is why we should crike.
You don't crike a laryngeal fracture. Don't listen to Edwina Scissorhands here. If they can't cut it, surgery doesn't know how to fix it.
Yes, so they are considering a crike. which is an emergency surgery to produce a hole in the neck so they could put the tube down into the lungs to help the patient breathe. And they're gonna consider it in this situation because the patient's mouth and neck are really injured. So trying to get a tube into their mouth down to their lungs might be difficult because the patient's very injured. So instead of that, they're gonna cut a hole in the neck and put the tube there into the lungs. It's called a cricothyrotomy. Very rare. Again, something else I have never seen in the ER.
I've never done a crike before.
No, Mel will do the crike. You've already had a busy morning. Glove up, Mel.
Oh.
No, I'm doing the crike, doctor.
You would be doing it, doctor, if it wasn't an odd day. Surgery gets even days, ED gets odd days. You know this, for Christ's sake.
So this is very realistic, okay? When a trauma patient like this comes in, the ED team is there and ready to take care of the patient. But what also happens is the surgery team is called down into the ED when a trauma like this arrives. That's because a patient like this who has had a serious trauma will probably need emergency surgery. So the surgery team is there also. So we're all on the same page at the same time, so we're not having to pass a report to each other. So surgery team is here when the trauma arrives. Because this patient now needs a very rare medical procedure, who gets to do it? The surgery team or the ED team? They're both there, they both want to learn, they both absolutely want to be part of this very rare emergency procedure. So what they're saying is because it's an odd day, the ED team gets to do the procedure and surgery gets the even days. So that's a fun way to break it up. That's not how we did it in the ERs I've worked at. I don't know how they split it up. Again, I've never seen a crike in person. So here we go, let's see them do it.
You ready to bag the crike?
Yeah, good.
Ooh.
Oh, excuse me. No worries. End tidal CO2 is yellow.
Yellow is yes, nicely done. Sew it in, okay.
Yes, sew it in. That's how you keep the tube in the neck in place. You literally sew it in. And now they have a tube that goes from the throat into the lungs so they can provide oxygen to the patient so they can breathe. Very good. Realistic? Yeah, we'll give it to them.
Dr. Robbie from the urine.
What's that?
It's a drug test, and it is positive for fentanyl.
No, that's impossible. Nick doesn't do drugs.
So they found fentanyl in the kid's urine sample. Not a good sign.
There are a lot of pills that are sold illegally that have fentanyl, not just painkillers. Xanax, Ativan.
No, not our son.
Well, maybe he didn't know that he took something with fentanyl. I don't know.
This is very realistic, especially for today. There is like a crazy fentanyl problem right now. Fentanyl is not dangerous if it's used in the hospital in a controlled setting. Doctors use fentanyl to help patients' pain all the time. The problem is now people who are not healthcare workers or not doctors or not scientists have found a way to make fentanyl and are putting it into the street drugs. And the reason they're doing this is because now if they lace a drug like Xanax with fentanyl and someone's taking the Xanax, they're being addicted to it because of the fentanyl and they're coming back to buy more to feed their addiction. The people who are buying these drugs don't know fentanyl is in there. We also don't know how much fentanyl is being added to these drugs. And fentanyl can be deadly if it's not used in a controlled setting, like a hospital surrounded by healthcare workers and cardiac monitors and medications in case something goes wrong. This is very realistic.
Hey, you, pasty white. How about a sandwich?
Classic hallway patient asking for a sandwich in the most unpolite way possible. Very realistic.
Can this patient get a sandwich?
I already gave you a sandwich, Earl.
I ain't ate this whole week.
Sure, give him another sandwich. They're on the food cart. Just make sure it's not egg salad or he'll throw it on the floor.
Okay, good to know. Thanks.
Very realistic. Sometimes the homeless, unhoused will come into the ER for whatever minor thing that they come in for. They know that if they act right and ask the right person in the ER, they will get a sandwich. Yeah, he's not getting a second sandwich for the patient. He's eating that sandwich. Healthcare workers get hungry too. I cannot tell you how many turkey sandwiches I've eaten, how many peanut butter jelly sandwiches I've eaten. Egg salad, I don't usually go for, but very realistic.
Got an unresponsive unhoused man coming in. Might be a good teaching case, funky music.
Another unhoused man.
Let's go.
Caucasian male, approximately 60 to 70 years old, found unresponsive. No signs of trauma, no ID.
On three. 1, 2, 3. Ooh. Did you take anything?
Smell the alcohol from here.
This guy's wearing the spring, summer, and fall collection.
Jesus.
What's wrong? What's going on?
Okay. Is it realistic? I've never seen rats come out of a homeless patient into the ED. What I have seen, maggots, cockroaches, a lot of cockroaches, never seen rats.
Because your son tested positive for THC, the psychoactive ingredient in cannabis, we're gonna have to admit him for overnight observation and monitoring.
What about his brain? Is there a chance that much pot is going to do some damage? I mean, he's only 4.
The honest answer is we don't know. There haven't been any long-term studies.
This is a child who accidentally ate one of his dad's pot gummies, which does happen. And you're lucky it's only pot gummies. Sometimes kids will get into the medication cabinet and take something a lot more dangerous. Pot, I'd say definitely lesser of the evils.
I'm the department's social worker.
Kiara will help you navigate the next steps.
Social workers.
What steps?
Well, a case like this requires mandatory reporting to child services and sometimes law enforcement.
No.
Why do you have to involve the police?
It's a controlled substance.
They're not taking my kid away.
Yes. You let the kid get into the drugs. What are we supposed to do? What's the social worker supposed to do? We don't know what your family dynamic is at home. We are just gonna take every precaution possible to make sure the kid is safe, which means occasionally calling Child Protective Services to do a review. Yes, realistic.
No one is touching my child! In fact, we're leaving.
Well, you can't take your son. He can stop breathing.
yeah.
I'll observe him at home.
Amanda, please.
Fuck off, Drew.
Get security. If you can't cooperate, I'm gonna have to ask you to leave.
Amanda, please. He needs to stay here.
And you need to get a fucking hotel.
Your son can't leave the hospital, but I can have you removed.
Don't you?
Yes, the son absolutely should not leave the hospital. He should probably be admitted overnight just to monitor him because it is a baby. He took some pot gummies. Probably shouldn't take him home without supervision from the hospital staff. Mom is understandably very upset, but this is kind of just what has to happen. Sorry. Pretty realistic.
Sorry, we had to move you into the hall. I know it gets pretty chaotic and noisy out here. Mr. Milton? Hey, Bennett, wake up for me. Oh, shit. I need a little help here.
Oh, shit.
Help!
When did you check on him last?
I don't know, around half an hour ago at most. I was waiting on laps.
What's going on?
It's my gallstone guy. You saw his EKG.
Unknown downtime, he was sleeping in the hall.
Okay, yeah, so this is the patient that they moved into the hallway earlier. He went unresponsive and has no pulse, and nobody noticed, which should not happen, at least where I work. There's usually a monitor near them to check their vitals. This patient was not hooked up to the monitor. If they were, you'd probably notice that their heart had stopped beating a lot sooner than they did. So this is very unfortunate. Is it realistic? I could see it being realistic for a hospital that was very understaffed and everyone was running around, but it looked like this guy moved the patient into the hallway. Wasn't really in a rush. Probably had time to put him on the cardiac monitor, so this probably could have been avoided.
Crash car, let's go!
He's doing CPR with one hand, and now he's doing CPR with both hands.
I got it.
There you go.
Hold compressions.
Asystole.
Resume compressions.
Asystole means that there is no cardiac activity. You don't shock asystole. If the heart's not beating, you don't shock it.
Slow tempo.
Should I intubate?
He's doing terrible CPR. First of all, he needs a stool. Where's the stool? Get him a stool. If a patient like this loses their pulse, the first thing you do, lay him flat, bring the gurney all the way to its lowest level, get a stool so you can step on the stool and do CPR. What you want is to have your shoulders above the patient. He's doing CPR like this. This is not good CPR. You're never gonna last like this. What you want is to get a stool, step on it so you're over the patient, and you're doing CPR like this. This is effective CPR. This is not. So, not realistic.
We switch out every few minutes. You can take a break.
I'm fine.
Hold compressions.
Still in asystole.
Resume compressions.
So in the ER, when we're doing CPR, we switch out every 2 minutes. There's usually a line of providers ready to do CPR, and you stop every 2 minutes to check the heart for any cardiac activity. And if there's none, you continue CPR. If there is, then there's possibility for shocking the patient or other things.
Should we shock him?
You don't shock asystole.
We could be fine VFib.
Not a chance.
Don't shock asystole.
Okay, when was his last epi?
3 minutes ago.
Okay, well, ACLS says every 3 to 5 minutes, right? So let's push another round.
Fine.
Where are they?
Yeah. Okay. Don't shock asystole. A lot of these medical TV shows, I think, when they see the flat line, they're like, oh my God, we gotta shock the patient. It's not true. You don't shock. That is asystole. You shock if there's like a weird rhythm. Very realistic. Good job, the PITT. But where is the stool? We're missing the stool. We need a stool.
We want you to put our father on the breathing machine.
Even though that goes against his desires to not be intubated.
We're not ready to let go yet.
Damn it!
And if your father is?
Oh.
He was a stubborn son of a bitch. He would never have given up on either of us. We're not giving up on him.
Oh my God, I don't know where they're getting this dialogue from, but it is like exactly what you hear in the fucking ER. He's a fighter. He would never give up on us. We're not gonna give up on him. We know he can beat this. This is so frustrating watching this.
I may have to honor his advance directive.
Mm-hmm. Can you do that?
No, you have to honor our durable power for healthcare.
Oh God.
If not, we can talk to your hospital attorney.
Oh, yes. I guess they are going to override whatever was on that advance directive and resuscitate the poor man. Oh, this is the kid who overdosed on fentanyl.
No, people wake up from coma. People wake them up. You can do that. You can talk. You can talk. It's bad.
Damn. It's pretty realistic. When something sad like this happens and a family member starts crying, you're gonna hear it. Because sometimes you get a private room, sometimes you get a curtain. Very realistic to hear someone crying, and it gets pretty depressing.
No cardiac activity.
Let's try calcium.
CPR still terrible.
No, his potassium was normal.
You ready to call this?
Oh.
Not yet. Dr. Robbie said 3 rounds of epi.
Yeah.
It's time. Let's push
no.
another amp. This one could do it.
Damn. Look at that. And yeah, so that's pretty realistic too. I mean, normally the curtain would be closed a little bit more, but this is the ER. A lot of times you're separated by curtains, you're gonna see everything that's going on. My biggest gripe is that he's still not doing CPR correctly, but I think that's the least of their worries. This show has a lot. We are only on episode 2. I've seen a crike. I've seen a floating face fracture. I've seen rats. Is this show realistic? It's definitely more realistic than it is not. Good job, the PITT, man. This is bringing back some crazy memories. I'm pretty excited to watch some more of the show. Also, I'm currently on tour for my comedy shows. Ticket links and dates are in my bio. I hope to see you in person live. Thanks for watching. I'll see you guys on the next one. Good night, motherfuckers.